Did you know that something like 80% of gray horses over 15 years old end up developing at least one visible melanoma?
Yeah, it's an incredibly high number. Really quite startling when you first hear it.
It is. And that's exactly what we're diving into today, this really common thing in gray horses,
Uh,
equine melanoma. Our mission really is to unpack it all for you. What is it? Why is it so common? What should you be looking for?
and how it's diagnosed, the treatments,
Yeah,
give you the full picture without getting too overwhelmed.
exactly. Because here's the thing that kind of blew my mind. We hear melanoma, we think sun, right? UV rays.
Usually, yes.
But for gray horses, nope. It's genetic. It's basically baked into their DNA from the start.
That's absolutely the core difference here. It's not primarily an environmental thing like sun exposure in people. It's tied to their genetics.
So not the sun.
Okay.
What does that mean then, practically? Why gray horses? What's the link?
Well, it's fascinating, actually. The gene that gives them that beautiful gray coat, that's a dominant gene, STX17, that same gene is strongly linked to their chances of getting melanoma.
Wait, so the gene for the color also makes them prone to melanoma. The thing that makes them gray
Yeah.
is tied to the tumors.
It sounds like a contradiction, doesn't it? But yeah, the graying process itself, it involves this sort of overproduction and buildup of the pigment cells, the melanocytes, in the skin.
Okay.
And the thinking is that this constant overactivity kind of wears out the stem cells that make those pigment cells for the hair. And this disruption, this disturbance in how melanocytes normally work seems to be what helps them turn into tumors.
Wow. So their signature look is kind of a double-edged sword. That's
Yeah.
quite something. Is there anything to the idea that how fast a horse grays matters? Like quicker graying means higher risk?
Oh, definitely. That's not just anecdotal. Research really backs that up. The speed of graying and the melanoma risk seem linked to how many copies of certain genetic bits within that STX17 gene the horse has.
More copies means faster graying.
And a higher chance of developing melanoma, exactly.
Is it all about STX17, or are there other genetic factors whispering in the background too?
STX17 is the main player, for sure. But there are other, let's call them modifiers. Little things,
Yeah.
like gray horses that were originally black or genetically black, homozygous at what's called the agouti locus. They might have a slightly higher risk.
Interesting, subtle differences.
Yeah, and other genes like MCR1 mutations can play a role too. It's complex.
And are certain breeds more likely to get these?
We definitely see it more in some breeds. Lepisaners, for example, are well known for it. Also, Pasofinos, Arabians, Percherons, they seem overrepresented.
And age. When do they typically start showing up?
The average age of onset is often around, say, 6 to 8 years old, but the incidence, the likelihood, definitely goes up as the horse gets older. That 80% figure is for horses over 15, remember?
Right. Okay, so understanding the why is one piece. But for you listening, the big question is probably, okay, what am I actually looking for? How do you spot these things?
Yeah, the practical side. Well, the classic look is usually these small, black, kind of dome-shaped bumps. They often feel quite firm if you touch them.
Firm bumps. Black.
Yeah.
Dome-shaped.
Exactly. And over time, they might sort of flatten out and spread into larger plaque-like areas.
And where should people be looking? Are there sort of hot spots on the body?
Oh, absolutely. They really prefer areas with less hair or no hair. So think under the tail, that whole area, the tail head, perineal region, right around the anus is very, very common.
Okay, onto the tail. Got it.
Also the genital areas. The sheath in geldings and stallions, the udder or vulva in mares, very common there too. And then the lips and eyelids are frequent spots.
Lips and eyelids too. Wow.
Yep. And the throat latch area, under the jaw,
But-
less often, but still possible. Inside the salivary glands, the parotid glands, or even way up inside the guttural pouches.
So they start small, these bumps. Do they stay small, or can they grow and become a bigger issue?
They definitely can. As the horse ages, the trend is for them to get bigger and for more of them to appear. Sometimes they even merge together into these larger clusters or plaques. That's called dermal melanomatosis.
And when does it cross the line from just being a lump to being a real problem for the horse?
That's the key question. Many are benign, they just sit there, but they become a problem if they get big enough to physically interfere with things. Like a large mass near the anus might make it hard to pass manure,
Oof.
or one on an eyelid could block vision, or if they're right in the corner of the lips, it could interfere with the bit. That's when they start impacting welfare.
That sounds awful. And I guess if they get really big or maybe rub on tack, they could get irritated, break open.
Precisely. That happens, especially large ones or ones in areas that get rubbed. They can ulcerate, they can bleed, attract flies, which is horrible.
Ugh.
And sometimes they discharge this black sort of tarry stuff. That's definitely a sign you need your vet involved.
And the scary question.
Yeah.
Can they turn cancerous? Like properly malignant and spread?
It's much less common in gray horses compared to melanoma in, say, a bay or chestnut horse, which is rare but usually very aggressive. But yes, they can become malignant in grays.
Okay.
They can metastasize. That means spread. Usually first to the local lymph nodes, but potentially to internal organs too, liver, spleen, lungs, even the heart or spinal cord in some cases.
And the signs of that kind of internal spread would be what? All over the place, I imagine?
Highly variable. It completely depends on which organ is affected. You might see signs of colic if it's in the abdomen, or breathing problems if it's the lungs, or neurological issues if it involves the nervous system.
Okay. So let's say you're doing your checks. You find a lump that looks suspicious. What's the next move? How does the vet confirm what it is?
Well, for gray horses, like we said, the look and location are often pretty characteristic. So a lot of times a vet can make a pretty strong presumptive diagnosis just by looking and feeling it.
Just visual impalpation.
Often, yes, for the initial assessment.
But to be absolutely sure, to know if it's benign or potentially malignant, what's the gold standard test?
Right. For that definitive answer, you really need a tissue sample. So either a biopsy taking a small piece of the tumor or a fine needle aspirate, an FNA, where you stick a needle in and draw out some cells.
Okay.
That sample then goes to a lab for histopathology. They look at it under a microscope. That confirms the diagnosis, tells you if it's a 9, technically a melanocytoma or malignant melanoma, and can even give clues about how aggressive it might be.
And that info is crucial for deciding what to do next, I guess.
Absolutely. It guides the treatment plan and gives you a better idea of the prognosis.
What if you suspect tumors are inside? You mentioned metastasis.
Yeah.
How do vets find those hidden ones?
Yeah, for internal ones, we need imaging. A vet doing a rectal exam can sometimes feel masses near the anus or deeper in the pelvic area.
Okay.
Ultrasound is really useful for looking at abdominal organs, checking the liver, spleen, maybe the gut wall for masses. And endoscopy, using a camera on a flexible tube, lets us look inside places like the guttural pouches or the upper airway and esophagus. Sometimes for really detailed planning, especially before surgery, things like CT scans or even MRI might be used.
What about blood tests? Can they tell you anything useful?
They can offer clues sometimes. If there's a really heavy tumor burden, especially if the liver is involved with metastases, the blood work might show things like mild anemia or signs of inflammation in the white blood cell counts.
Like an inflammatory leukogram.
Exactly.
Sure.
And you might see elevated liver enzymes. But blood work alone isn't diagnostic for melanoma itself.
Right, it's more supportive information. Okay, so diagnosis is done. Now, the million-dollar question for owners. What can you do about them? It sounds like there isn't just one answer.
No, definitely not. It's very much tailored to the individual horse and the specific tumor or tumors. You have to consider the size, the location, how many there are. Is it acting benign or malignant?
Then the horse's age, general health.
All of that, yes. It's a complex decision tree.
So if a tumor is small, not causing any trouble, just sitting there, is doing nothing an option, like just watching it.
Absolutely. That watch and wait approach is very common, especially for small, slow-growing ones and older horses where the risks of intervention might outweigh the benefits. Regular monitoring is key, though.
Monitoring how? Just keeping an eye out.
Keeping an eye, yes, but also maybe measuring them periodically, taking photos to track any changes over time. That helps you and your vet decide if intervention becomes necessary later.
Okay. What about actually removing them? Surgery.
Surgery or surgical excision is often the go-to for smaller single tumors that are easy to get to.
Just cut it out?
Pretty much. It can be done with a standard scalpel or sometimes a CO2 laser is used, which can help minimize bleeding, especially in vascular areas.
And is the thinking generally get it out early?
Yes, the current recommendation often leans towards early and aggressive removal, meaning getting clean margins if possible to try and prevent it from growing larger locally or potentially spreading down the line. And often, after removing these, the site isn't stitched closed. It's left open to heal from the inside out, what vets call healing by second intention.
Interesting. What about other removal methods, like freezing?
You mean cryosurgery? Yes, that's an option too, particularly for smaller, more superficial lesions. It uses liquid nitrogen to freeze and destroy the tumor cells.
And you mentioned injections earlier. injecting things into the tumor. What gets injected?
Right, intralesional injections, often it's chemotherapy drugs like cisplatin or carboplatin. They're put directly into the melanoma.
Does that work well?
It can be very effective for controlling the local tumor, shrinking it, or slowing recurrence after surgery, for example. And then there's that more unusual one.
The frankincense oil.
Yeah. There are anecdotal reports and some early research, actually, suggesting that injecting oil of frankincense directly into these tumors can cause them to regress. Sometimes quite dramatically, apparently, even causing them to sort of burst.
Wow, that's wild. From ancient remedy to potential treatment.
It's definitely an area of interest, though more rigorous studies are needed.
Okay, so beyond cutting, freezing, injecting, are there more maybe systemic or immune-based treatments? I think I've heard about a vaccine.
Yes, immunotherapy is a really interesting area. The main one used in horses is actually a vaccine licensed for dogs, the Onecepti canine melanoma vaccine.
A dog vaccine for horses. How does that work?
It's what's called a xenogeneic DNA vaccine. It contains the gene for human tyrosinase, an enzyme involved in pigment production. The horse's immune system sees this human protein as foreign and mounts an attack against it.
Okay.
And because the horse's own melanoma cells also have tyrosinase, which is similar enough, the immune system then gets sort of tricked into attacking the melanoma cells too. It's cross-reactivity.
So you're basically training the horse's immune system to recognize and fight its own cancer cells using a related target from another species. That's clever.
It is quite ingenious.
What's the process like for the horse, and how well does it work? Is it a cure?
The typical protocol is a series of initial shots, usually 4 doses, maybe 2 weeks apart, and then booster shots every 6 months or so. As for effectiveness, it varies a lot.
Right.
Some horses show really significant tumor shrinkage, maybe 25 to 50% reduction. In others, it might just stabilize the tumors or slow their growth. It seems to work better on smaller tumors, maybe more for preventing new ones or slowing progression than for eliminating really big established ones.
So not a magic bullet, but another tool in the toolbox.
Exactly. And there are also autologous vaccines where a vaccine is custom made from the horse's own tumor tissue, trying to stimulate a very specific immune response against that particular melanoma.
Are there any pills or creams people can use?
Well, there's cimetidine, which is actually an H2 receptor antagonist, like an antacid. It's been used off-label for years.
Does it work?
The evidence is pretty mixed, honestly. Some anecdotal reports suggest it helps, but larger studies haven't consistently shown a strong benefit. But it's relatively cheap and doesn't have many side effects, so some vets still try it.
Okay. And creams.
There's some development in topical creams. People are trying things with ingredients like, again, frankincense or turmeric, green tea extract, nicotinamide. The idea is maybe to support healthy skin cells locally or perhaps slow down the growth of external tumors. But again, mostly supportive, not curative.
And if surgery isn't possible, maybe because of location, is radiation ever used? Like in human cancer treatment?
It is an option, yes. Radiation therapy can be used for certain types of melanomas in specific locations, especially when surgery isn't practical or would be too damaging.
Okay, quite a spectrum of options then. So putting it all together, what's the overall outlook? If your gray horse gets diagnosed with melanoma, how worried should you be?
Generally speaking, the prognosis for gray horses with melanoma is actually considered good to excellent for them living a long and useful life.
Really?
Yeah.
Good to excellent. That's
Awesome.
probably surprising to many people.
It is, especially because melanoma sounds so scary. But it's crucial to differentiate this from melanoma in non-gray horses. That type is rare, but usually highly malignant and carries a much poorer prognosis. Gray horse melanoma is often benign, or at least slow to progress for a long time.
That's a really important distinction. So what makes the prognosis better or worse in a gray horse?
Several things. The size and number of tumors matter. Smaller and fewer is better. Location plays a big role, too, if it's interfering with function, like defecation or eating. That makes the functional prognosis worse, even if the tumor itself is benign.
Right, quality of life impacts.
Exactly. And then, of course, if it does turn malignant and starts to metastasize, that obviously makes the prognosis much more guarded. And like we said, catching problematic ones early and intervening makes a big difference.
So bringing it all home for you, the listener, the gray horse owner, what are the absolute must-dos, the key takeaways?
Number 1. Regular checks. Really get in the habit of thoroughly looking over your gray horse, especially in those common spots under the tail, genitals, lips, eyelids.
Make it part of your grooming routine.
Definitely. And maybe keep a simple log or snap photos with your phone to track size and appearance over time. Any changes, note them down.
Okay, check regularly. What else?
Number 2, vet check for any new or changing lump. Don't just assume, oh, it's just another melanoma. Get it looked at. Let the vet assess it.
Don't self-diagnose.
Please don't. And number 3, be proactive with management. Discuss the options with your vet. Even if you choose to monitor, do it actively. If a lesion starts causing problems or growing quickly, act on it early. Regular vet rechecks, maybe every 6 months or yearly, are a good idea too.
And what happens if things aren't managed or if they progress despite treatment? What are the potential complications down the road?
Well, besides the functional issues we talked about, trouble eating, defecating, mares might have issues foaling if there are large masses near the vulva. The main concern eventually is metastasis, if it occurs. And the effects of that, as we said, really depend on where it spreads. It could be anything from colic to respiratory distress to neurological problems.
So staying vigilant is key throughout the horse's life.
Absolutely.
This has been incredibly thorough, really understanding the genetics, what to look for, the treatments. It feels much less mysterious now, and hopefully gives you, the owner, a real sense of empowerment.
That's the goal. Knowledge really is power when it comes to managing these common conditions and making sure our horses stay comfortable and healthy.
So as we wrap up, here's something maybe to chew on, a little food for thought for you. We just talked about how one single gene, STX17, profoundly affects both something visible like coat color and a major health predisposition like melanoma. Makes you wonder, doesn't it? What else out there in the animal kingdom is being shaped in such deep, interconnected ways by just a small piece of the genetic code? Something to perhaps explore further if you're curious about genetics or veterinary science.